Welcome. I'm Professor Khalid Khan. I'm based at the University of Granada in Spain. Today, we will talk about obstetric violence. Concerning this, we have produced earlier a video with numerical data, but today we will provide information concerning the experiences of abuse suffered by mothers in labor and childbirth. To discuss this, I have with me Dr. Carmen Amezcua. Carmen, can you please introduce yourself?
Yes, I am Carmen Amezcua. I work with Professor Khalid Khan in the Department of Preventive Medicine and Public Health in the University of Granada. And we have the chance to publish this paper last year. And today we are going to present the qualitative part of this paper.
Okay, so here is the published paper. And before we go forward, I think it will be good to just review what is the definition of the term obstetric violence.
Yeah, we define the obstetric violence in our first blog about obstetric violence as a disrespect and abuse to the women when they are attending or mistreatment. Also, it could be psychological mistreatment or verbal or physical, and is induced or inflicted by the care provider.
Okay, so here is an outline of the paper we have been referring to. We previously reported that the prevalence of, for example, shouting or other form of abuse is quite high. So that's why we were interested to present to you further information concerning how women reported their experiences. So, Carmen, can you say a few more words about how we landed with these 11 studies?
Yes, if we wanted to know the experience of these women, we need qualitative studies. That's why we decide to select, well, we select with our criteria selection these 11 studies. Um, every single one, it was a qualitative study. So what the researchers did in those studies were to interview the women and to ask them what was their experience in the delivery when they were in the hospital. So they record these interviews and then they transcribe them. After that, they have to analyze the test and extract the codes of that test and then create categories and themes. That is what we are going to present here today.
Okay, so nearly 4,000 women, above 4,000 women have given these type of interviews, whose data we have collated and we are going to present in this video. The key thing is that for researchers who want to undertake such a study, it's not like they can just go in and start recording. They first have to prepare a protocol. This need to get approval by the ethics committee. Then they have to obtain consent from the women who they are going to interview concerning their experiences. The interviews are recorded, and the information recorded as voice is then transcribed into text. These texts are then formally analyzed by the researchers.
Yes, and in this case, for example, we have an explanation of one of the women of these studies. We have the 11 studies, so this is an example of one of them. And here we can read what the women experienced when she was attending. We can see here that the professional wanted to deliver the baby as soon as possible. And in the second case, this is a study of Switzerland in 2022. And what we can see here is that the professional didn't care about the preferences that the woman had in the delivery. So also from this test, we can extract more information. In the first paragraph, we can see that the mother suffered coercion and pressure by the staff to accept some procedures, and in the second one, a failure of informed consent.
Okay, so from the studies, 11 studies that we've been referring to, We now present information from Ireland, Portugal, and Spain. Here, the abuse or maltreatment or mistreatment by professionals is highlighted in the interviews, as well as lack of information, as well as racial stigmatization, for example.
And that is the case of Ireland, Portugal, and Spain, as Professor Khalid said. But we can see in other countries, European countries, as Sweden or Switzerland or Netherlands, uh, other type of expression for women that are very similar. For example, little or no information given to the women, or disrespect treatment, or lack of informed consent.
Okay, this theme of lack of informed consent goes further in the case of Israel as well, associated with pure communication. But what is really concerning here, as a former gynecologist, is that people are performing invasive examinations without any informed consent.
And that is the case also in USA, for example, because they exams the vagina without any given consent for the women. Or, so they feel coercions, and also they are being told to shut up. In Australia, they also inform about disrespect by the providers or the professionals, or mistreatment, and also they are forced to be to have intervention that they don't consent.
Well, all of this is highly concerning. We are talking about countries which consider themselves civilized. They don't have any shortage of resources or lack of education as an underlying problem. And at the same time, women in these societies, at a time when they need great deal of care, attention, and respect, are suffering disrespect, failure of consent, and are at the same time receiving shouting and scolding. What is going on, Carmen?
Well, we are not in the clinic every day, so we exactly don't know the real answer for this. But we presume that professionals are they have a lot of works to do, and they are not conscious of this problem. So what we want to do with this is also is to show that this problem is there, and they should be conscious about this, and also to take some part to solve the problem.
Okay, Carmen, hopefully with this video we can spread the message better. And in the future, the outcome will be better for women during their labor and childbirth. Thank you.
Thank you to you.